name is Dennis Delasi, and I'm one of the co-founders of Hewale, which means good health in the local Ghanaian language. Having had varying experiences with the inefficiencies of the Ghanaian healthcare system, our company has set out to change this. Let me tell you the story of our entrepreneurial journey. Let's have this page represent a map of my neighborhood. Mr. Asante, a retiree, suffered heart failure at home. And when he summoned a taxi that will serve as his ambulance to take him to the hospital, they had the option to take him to Koko Clinic or Kaneshi Polyclinic, which are both equidistant from his home. He was taken to Koko Clinic only to be told of the unavailability of beds. And by the time they arrived at Kaneshi Polyclinic, his condition had deteriorated. Mr. Asante didn't make it back home. This is the story of many Ghanaians. And as a company, we thought that we could help people in their hospital decision-making by creating an application that will update them on bed availability in these hospitals. But we were wrong, and I'll tell you why. When we started speaking to nurses who would have been pivotal to the success of our application, it became increasingly clear to us that not only do they have to deal with large volumes of patients like you see up here, but then patient information management in these hospitals was largely inaccurate and inefficient. And in fact, for a nurse to ascertain the number of beds available in these hospitals at a point in time, she would have to go around the ward and count. This was not optimal. And so what we thought to be a rerouting problem was just part of a bigger problem of patient information management in hospitals. And this is why patient information is largely stored in paper folders in these hospitals today. And it takes about 30 to 45 minutes for a patient folder to be retrieved. These folders take up a lot of space in the hospital, and the search and retrieval process is prone to human error. In some cases, patient records are lost due to carelessness of nurses. And so from our extensive customer research process, we spoke to nurses, doctors, and hospital administrators, and they made it known to us that they need to implement some kind of electronic medical record. And this is what we are doing. We are creating an electronic medical record that is optimized for use in these hospitals. And so, I know you're wondering why Ghanaian hospitals haven't adopted EMRs if they've existed in the US for over 30 years. Well, it would surprise you to know that a lot of the EMRs that exist currently are not built to function perfectly in our setting, and I'll tell you some of the reasons. One, most of the electronic medical records that exist currently require internet access to operate. And in a country where internet access is expensive, the cost is just prohibitive to its adoption. Another reason why electronic medical records have not been adopted in these hospitals is because they rely on a lot of heavily coded text to encode patient information and diagnosis. And this provides a new learning challenge to Ghanaian doctors who would rather prefer free text. And so we are building a system that is perfect for these people by using an open source electronic medical record that's available and taking their input to create a system that works perfectly for them. This will allow them to streamline transactions between their clinical teams, but also by allowing them to ease the patient's data retrieval and storage. For the patient, this will mean that they'll have a better overall clinical experience. And for the hospital, they'll be able to better manage their insurance claims, which will translate into more revenue for them. Let me paint a little picture about the health capacity of Ghanaian hospitals. And so the doctor-to-patient ratio in Ghana stands at 1 to 13,000 currently, compared to 1 to about 400 in the US. And then at first glance, it seems that our biggest problem is a human resource one. But this is not entirely accurate. A recent study on the health capacity of Ghanaian hospitals showed that the average urban private clinic is operating at an efficiency of 32%. And that means that they could see about 13 more patients per medical staff per day. What this means is, if we are able to implement an electronic medical record in these hospitals, the efficiency gains will have an effect equivalent to adding 755 new doctors to the Ghanaian healthcare system. This is about 30% of the doctors we have currently. And so clearly, our biggest problem is not the human resource one. We are really excited about this opportunity because health expenditure in Ghana keeps growing. In 2015, it stood at $1.5 billion and is expected to grow to $2.5 billion in 2021. If we can enter the market at this point, we'll be positioned for a lot of growth. We have a very excited team that is passionate about this issue. We have experience varying from computer science, statistics, and healthcare, and we are really excited to bring this on to take on this challenge. We would like for you to get in touch with us if you have connections to agencies that support healthcare in Africa, and then if you have experience in selling software in low-income markets. Thank you.